We are joined now by Dr. Jeanne Conry, past ACOG President and the current Chairperson for the Women's Preventative Services Initiative. Great to meet you.
So nice to meet you. Thank you very much for doing this interview.
For sure. Tell us about what exactly is the purpose of the Women's Preventative Services Initiative.
We realize that with women's health care, women may see a variety of physicians to provide preventive services. It may be either by their choice or circumstances. They could see an obstetrician gynecologist, a pediatrician, an internist, family doc, a nurse practitioner, midwife, PA, for their preventive health care. But we also know that none of those medical specialists are sharing notes on what they're providing. So this is a collaborative effort to bring everybody together and come up with consistent recommendations on how to provide preventive care.
And why should providers follow those recommendations?
Well, we've got a group that's really focused on the science behind how we should provide care. So we've looked at recommendations across the lifespan of a woman, and our goal is to provide age-specific and gender-specific recommendations to improve their health care.
Can you give us an example of where we don't see consistent messaging coming from providers to the patient?
Probably the ideal example is a 34-year-old woman with type 2 diabetes. If that woman sees her internist or her family practice doc, I know they're going to talk about cardiovascular risk and long-term cardiovascular needs. But that woman is at risk with reproductive choices. Is she interested in conceiving? Has she had preconception advice? What is she using for contraception? Oftentimes, a family practice doc or an internist isn't going to address that. But if that same woman saw an OBGYN or a nurse practitioner, we are almost always going to be talking about her reproductive choices. What is she using for contraception? But we may not be talking about cardiovascular disease. That woman needs both. So if we're looking at preventive health, we need to talk about reproductive health choices and her long-term chronic care needs on how to optimize cardiovascular risks.
And what do you hope to see, looking into the future of women's health care and services, what do you hope to see?
I would love to have a woman be able to see any provider, and no matter who she's seeing, there will be a consistency about recommendations, so we've optimized her health care. In the end, this is really about improving the health of this generation and future generations, and I think we can achieve that goal.
So important. Thank you so much.
Thank you.